We also talked about the liver function and baseline blood tests. But the one thing we haven't spoken about yet that's really crucial to the diagnostic workup and treatment planning for patients with pancreatic cancer, which is not often, I wouldn't say not often, it is often done, but not by everybody. But in our practice, it's standard to get genetic testing. And there's two different flavors for genetic testing that I wanted to go through with you guys. One of them is called germline genetics. That is the family tree DNA that you are born with and can pass on from generation to generation. So, germline genetics are mutations in the reproductive cells of our body, and they can be passed on to the offspring. So, mothers and daughters who have a gene called BRCA, first identified in breast cancer, hence BRCA, but are also important in other cancers like ovarian cancer and prostate cancer and pancreatic cancer, which is why it's relevant to our conversation today. There's also something called somatic mutations. And somatic mutations are not actually mutations of the family tree or the hereditary DNA, but actually mutations in the tumor itself. So these are not passed on from generation to generation, but they can be identified when we take a sample of the biopsy or a sample of a patient's blood and send it to specialized labs. So that's the next 2 points here is that there's a tissue biopsy and a liquid biopsy. This is more modern, less invasive, still gives us good information, but the gold standard is to get a tissue biopsy, which we talked about, and we can send that for something called next generation sequencing, or NGS for short. On the bottom of the slide, I just, this is not comprehensive by any means. There are many, many companies out there, lots of biotech um, uh, innovation going on. Personally, our preference, and again, this is not standard by any means. All of these companies are fantastic, but the top three, Ambry, Invitae, and Myriad, those are companies that we use for the germline genetics, looking at somebody's family tree. The bottom, Caris, Foundation, Tempus, Guardant, are all really good companies to do the molecular testing on the somatic side, looking for the tumor's DNA. And it's really important because this comes into play when it comes to treatment planning. Because if we have a mutation on the tumor that could be targeted by a drug, this is becoming more modern medicine. We call it precision oncology. And it's making its mark in 2025 in terms of figuring out the molecular landscape of different types of cancer. And pancreatic cancer is no different in that there are certain genetic alterations of the tumor that could make certain drugs a better choice than others when it comes to treatment planning. And we'll go through that. But my personal preference, because I was trained this way and I find these tests to be great, not that there's anything wrong with the other companies, but I use Caris for my somatic tissue biopsies, Guardant for the liquid biopsies, which is a simple blood test, and Invitae, which is a germline genetic test on either saliva or blood. But it's important that you and your practitioner discuss genetic testing when it comes to pancreatic cancer because it really is important in guiding therapy and talking about prognosis. There are certain people, it's a little bit bittersweet, but there's certain people, if you do have the BRCA mutation, tend to have better overall prognosis when it comes to pancreatic cancer. The caveat and the upsetting part is that this is typically something that is going to be passed on in the family if you have one of these germline genetic mutations. So it could parlay different screening philosophies for kids or first degree relatives. When we talk about the molecular profile, the reason we're sending these tests, there's the four big ticket mutations we look for in pancreatic cancer. There's something called a KRAS mutation, KRAS. That makes up about 90% of the cases. There's also TP53, CDKN2A, SMAD4. Again, very scientific, very nerdy, lots of letters, lots of syllables. Not too important for you, but important for the provider because we have a lot of different um, clinical trials and studies going on right now looking at KRAS inhibition, pills that could turn off the signaling that may have led to your cancer being born in the first place. On the bottom, I list these what we call actionable alterations, where we actually have drugs that could potentially inhibit the signaling that led to these tumors from being turned on. I don't know if that's clear, but I put the 4 stars here as the big four. But there are other ones. If you are found to have a BRCA mutation, we have drugs called PARP inhibitors that may help keep that signal off. If you have a tumor that's growing and growing and growing because there's a signal like a light switch that's stuck on, but we have a drug that can turn the switch off. That really sometimes is helpful regardless of the cancer type. It's very rare to find BRCA mutated pancreatic cancer, about 5 to 7% of cases. Same thing with these MSI high tumors, only about 1 to 2% of them. But all in all, these are important things when it comes to diagnosing pancreatic cancer and understanding your particular disease.